Hello everyone and welcome to the press conference of World Health Organization at DRMC Model Level Conference 2022. My name is Ahmed Kabir, proudly serving as the Chief of Press alongside our sub-editor Mr. Amlan Ahmed. We also have the executive board members of WHO. Kindly request them to be recognized. Sir, could you please?
So, I am Abhishek, the chairperson of World Health Organization. Along with me, my vice chair.
I'm Lamia Zwana, the vice chair of WHO. And we have with us.
My name is Almaghrib bin Atur, and I'm the director for World Health Organization.
Perfect. Thank you so much. With further ado, let us hear from some of the delegates about what they have been discussing in the past few days. We'll hear from any volunteers, by the way. So we'll hear from UK first. Let's hear from UK. 20 seconds.
Thank you, Honorable Chief of Press, for giving the floor. In the course of the past 2 days, we have had discussions on various vaccine-preventable diseases, focusing on COVID-19, and to find equitable solutions, focusing on vaccine distribution and proper solutions to immunization.
Thank you so much. Moving to China.
So thank you so much, Dad, for giving me the floor. The delegates in this council has been relentlessly working hard to ensure the equitable distribution of vaccine-preventable diseases vaccines and prioritize on COVID-19 because that is the issue at hand, and trying to integrate that into global cooperation and national healthcare security policies as well.
Thank you so much. Chinese delegation. We move to Norway.
Thank you, Chief of Press. Understand that we have been discussing about the main stakeholders of this agenda who have been the insufficient access to immunization, the countries that are not getting provided with enough immunizations, and we have also find out the cause, that is those countries who are producing those vaccines and yet stockpiling them. So we hope to come up with a solution from these two stakeholders. Thank you.
Thank you. And last but not the least, the delegate of Singapore.
This committee has worked tirelessly to save lives throughout the whole world. And vaccine-preventable diseases are nowadays a really, really big issue. And coronavirus is just one part of it. So the delegates of this committee are trying their heart and soul to improve the situation, to save lives, and throughout the world, the children can smile in peace. Thank you.
Thank you so much for the information. The floor is now open for questions. Are there any correspondent who want to pose a question? We will start with Al Jazeera.
Belgium just started their first case, just recorded the first case of the new variant. At the same time, they're seeing mass protests against the COVID rules. The press wants to know, how will they tackle this situation?
Do we have the delegate of Belgium? Yes.
Did you reply? Firstly, we are trying to calm down the protesters slowly, listen to them, and then get into a conclusion with them as they are a part of us. But at the same time, those who break the laws will be taken under jurisdiction. Secondly, Belgium's Prime Minister announced nightclubs will be closed and bars and restaurants will be shut down by 11 for 3 weeks from Saturday, have max 6 people per table. Besides that, we have constructive movement restrictions and so on. Thank you so much, sir.
Thank you. Next question. We will take New York Times and then we'll move to BBC. So New York Times.
Earlier in the session, the Israel delegate assured of donating COVID-19 vaccines to Palestine. The press wants to know from the delegate of Israel, what's the progress on this plan?
Yes.
The delegate doesn't want to comment in this issue.
Thank you for your choice. We move to BBC.
There are a lot of misconceptions about vaccinations in the US. There are a lot of anti-vaccination. The press would like the delegate of USA to clarify this.
We do follow up on
Yes.
live.
Yes.
So as the correspondent stated that in USA we are facing some anti-vaccination movements, or we are facing anti-vaxxers. So the thing is that anti-vaxxers not only exist in USA but also exist throughout the whole world, as USA is not the only country that's facing this problem. Countries like New Zealand and China also have anti-vaxxers, even Russia. So USA is planning to do things or take actions against this problem. USA has been taking counseling, one-to-one counseling sessions to anti-vaxxers to clarify any doubts. And the main reason why USA believes that anti-vaccination are occurring is due to misconceptions and wrong information. USA is mainly trying their heart and soul to alleviate or diminish or eradicate this kind of misconceptions so that people should get vaccinated and people should not protest like this. Yes.
Thank you for your support of the agenda of getting people vaccinated. We move to the next question with Associated Press and then AFP. Associated Press first.
Numerous allegations of unequal access to vaccines and supply delays have resulted in the resignation of numerous hospital administrators. Thus, the press wants to know from the Portuguese government how the government is avoiding these circumstances when they're confronted. Thank you.
Portugal?
Can the correspondent refresh?
Definitely, just the main part of the question.
So the government positions to avoid when confronted with these situations, with the situations of the resignation of the hospital administrators regarding delays of vaccines.
Okay, so the government, the health, especially the health ministry of Portuguese Republic, when the issue came up, the health ministry come with one solution. They took the health administration in action. They revised their questions, arguments, and they have taken them in jurisdiction and initiated some penalties. Yes, and that's all.
Thank you so much, sir. Moving to AFP.
The press wants to know from the delegate of United Kingdom how they are going to tackle the possible outbreak of the new variant when their own prime minister is breaking the health protocols.
UK, the floor is yours.
Thank you for the question. United Kingdom's Prime Minister, United Kingdom has taken steps in order to tackle this issue, and we are supporting vaccine, and people will be getting vaccinated with booster dose as soon as possible. And United Kingdom, being the global leader of health, will tackle this problem as the global leader of health and come forward.
Does the representative of UK want to make comments about the actions and the allegations against Boris Johnson?
United Kingdom, honorable delegates and press, United Kingdom's Prime Minister recently have apologized to the Queen, and we absolutely appreciate this decision. And the delegate do understand that people do make mistakes, and we are humans at the end of the day. We also have shortcomings, and United Kingdom's president have understood this and have come to a ground which clarifies and the problem, and hopefully the other nations and press understands this.
Thank you for your remarks. And just for so that nobody gets confused, we were referring to Boris Johnson, the Prime Minister of UK. Moving to the next question. Any question? So we will take Xinhua, followed by Times of India. Xinhua first.
The press wants to know from the delegate of Russia that vaccines are the ideal method of immunization, yet the vaccinated people are being affected. What are your views on that?
Sir, thank you, press, for so delegate. Don't want to answer the question. No comments.
Thank you. Send our remarks to Mr. Vladimir Putin. So we move to Times of India.
When the suicide hotlines like Kanpete Roy even answers the call after 3 days, the press wants to know from the delegate of Bangladesh how Bangladesh has a good mental health.
We want to know the mental health rate and comments about the Bangladesh representative on that.
Delegate of Bangladesh, you follow? The delegate of Bangladesh would like to know the sources of that information.
We have our sources, and the comments, we believe the comments are true. So we just want to know your thoughts on that.
The delegate of Bangladesh would like to reply back.
Sure, thank you. Moving to the next question. CNN.
The press wants to know from the delegate of Norway, how do you plan on tackling new viruses who might appear during this pandemic if you devote most of your resources for COVID-19?
Free to follow, sir. Understand that we are currently dealing with COVID-19 and all our researches and developments are more or likely focused on that perspective. Unless or either we face another virus in this upcoming pandemic, we will move our resources to that emerging virus immediately.
Thank you, sir. We hope you succeed in your journey. Thank you for your comments. We will take 2 more questions. Any other questions? Any other questions? Reuters and we'll only take Reuters, unfortunately. We don't have much time. Reuters.
What are the roles the top power countries of the world playing in ensuring that the spread of vaccine-preventable diseases in remote areas is being stopped? The press wants to know, and this is a question for all the delegates.
Anyone can answer. So let's see who wants to answer. We'll take Iran, China, UK. Anyone else? Singapore. So Iran, of course.
In case of the pandemic that we are facing today, we think the only facility that can get us through this is cooperation. And the cooperation that WHO has built up is joining an initiative called the COVAX. And the COVAX has been really efficient in terms of dealing with which country needs what amount of vaccine. But they unfortunately haven't been able to provide all the vaccines because of the number of vaccines being hoarded or not being able to be given in time and be given the infrastructure that are needed. So we think in terms of rural areas of setback countries or developing countries, what we know is the fact that we think it's an inherent problem of how our civilization has been formed, but there are many infrastructure that are being built for that matter. We think at the end of this committee, the WHO will eventually find a fund and eventually find a joint commission which can come together and build infrastructure for serving those people in those rural groups and rural regions in the particular part.
Thank you. China.
Thank you, Das. So understand that the delegates have been working hard to ensure that each and every nook and corner of each country gets the equal amount of vaccine distribution. However, we need to understand that we are going for an equitable distribution. That means that inside of the rural people, we are trying to identify the priorities and then set our priorities into that. We try to integrate the national data and the global data and try to mix them up and try to ensure the proper flow of vaccination across the whole world. Does not mean that this is centralized. This is decentralized and going into every corner of every country.
China, let's hear from UK.
To tackle this problem, in this Committee of World Health Organization, we all have been working together and we are expecting global cooperation to tackle this problem and to combat the VPDs and the pandemic at hand. For this reason, as the other 2 delegates have already mentioned, we are looking forward for vaccine equity, and that will mean setting our priorities and then going to rural and marginalized communities and giving them vaccines according to their needs. However, as the world is concerned about hoarding of vaccines, the delegate would like to make a statement that the hoarding vaccines, the improved and developed nations have all had supplied vaccines. However, as the Omicron, as COVID-19 is mutating and Omicron is taking its charge, the research and development is also improving, and the developed nations are working on it so that the proper vaccines could be sent to equitable people. And for this reason, the developed nations are working, and we hope to come to a common consensus at the end of this committee through a draft resolution.
Thank you. Singapore.
To the correspondent of Reuters, we are in a crisis here. The COVID-19 is a crisis throughout the world. It's a pandemic, and in this situation, there is chaos everywhere. But we delegates of WHO are trying to minimize the chaos and trying to find a proper solution, and that is why we have taken steps, so many steps. First of all, we have built COVAX, and we are ensuring that COVAX is doing its job properly. And also, third of all, we are also trying to motivate other countries, developed countries, to donate much more so that the production of the vaccines are increasing exponentially. Thank you.
Thank you, everyone. That's the end of the question answer session, and we're reaching the end of the press conference as well. For the viewers who are joining us right now, the agenda of WHO has been improving access to immunization and halting the spread of vaccine-preventable diseases. They have been discussing in the past 2 days, and they will continue to discuss for the next few hours until they come to working document or draft resolution. Let us hear from the executive board members. First, I'll request our honorable chairperson to make his comments about how far WHO has progressed in the past few days.
Thank you, Honorable Press Conference Chief. So, and Honorable Chairperson. So, regarding the fact that WHO committee has come to a sense that the vaccine or the immunization and the distribution regarding the countries are doing a very lenient way, so that there we can see there are some authority who are having the access vaccine in their own, and they are coming to the fact that what are the countries that are not getting proper vaccination, and the countries are coming to the fact that we cannot stop the virus or the diseases to be spread. And we also know that prevention is better than cure. So we are now moving forward that the countries come to a sense with their remarking vaccine policies, so that the committee could get a fruitful resolution. Thank you.
Thank you, sir. Moving to the vice chairperson, ma'am. How has your journey been working with the delegates? I believe there's a mix of first-timers, some experienced one, and some advanced delegates. So could you share some of your experiences working with the delegates?
As we have many first-timers in the committee, and we hope, firstly, we thought that they wouldn't be able to work up to the mark with the other delegates who are more advanced and experienced, but astonishingly and surprisingly, they are doing so well, and they are competing head-to-head with the advanced and experienced delegates as well. And to be honest, the committee is going well so far, and we're hoping to come to a solution today. Thank you, sir.
Thank you, ma'am. And finally, let's hear from the director of WHO. Your thoughts on the agenda. Do you think the topic is something really feasible and right based on situation? And how would you encourage others to get vaccinated?
Delegates, a wise man once said, "Who will save the world?" And exactly that is happening. Who will save the world? World Health Organization has been working relentlessly every time a pandemic occurred. We have been saving everyone. The global pandemics, all sorts of outbreaks have come to a stop, or at least come to some sort of haltage due to the efforts put in by WHO. We have been working with Gavi, and we have been working with UNICEF to put a halt to the current outbreak. Every delegate in this room are being transparent about the number of vaccines they have. They're having plans to donate it to the lesser developed countries. They're having treaties and plans to supply vaccines to the other countries. They are being very selfless and very caring for the citizens of the other country, because you cannot stop the vaccine in one country completely if the vaccine isn't stopped in every other countries of the world. So regarding the agenda is completely feasible, because who has always been given responsibilities more than they can handle, and who has always delivered. It wasn't UNSC who solved the COVID-19 outbreak. It has always been WHO, and who will keep on saving everyone. Yes, who will save the world, delegates.
Thank you, Honorable Director, sir, for giving the faith or the confidence that WHO will definitely save us. Before we conclude, I want to hear once more from our chairperson. How happy are you with the overall performance of the committee? How has they met your expectations?
So the thing is, I will start that happiness is choice, and it's the box of chocolates that the delegates given me in their speeches. So I am quite pleased with their performance regarding now up to today. So because day 1 and day 2 were quite of just imbalance with the experienced one with the new ones, and the newbies are doing very much head-to-head competition with the experienced ones. So my satisfaction part is that it's quite good, and let's see the opposite side of the coin, that it's the game plan that flips. So how the experienced one deals with the newbies, it will be in their part. So I'm quite happy. Thank you.
Thank you so much. On that note, we wrap up the press conference at World Health Organization at DRMC Model Event Conference 2022. Until the next update comes, please stay tuned on the Facebook page. Goodbye.